Hello and welcome to my channel. Today we'll talk about the vascularity of the central nervous system. So let's begin. The cerebral vasculature, or called the cerebral blood flow, if stopped for 5 to 10 seconds, unconsciousness results. If continued for 6 minutes, results in brain death, and it's about 900 milliliters per second. It takes about 15% of the cardiac output. The arterial supply by the two major systems, the carotid system in front and the basilar system posterior to it. And note that the vertebral basilar system, the vertebral artery, runs within the foramina transversaria of the cervical vertebrae. So it's susceptible for compression if there is, something wrong with the discs between the cervical vertebrae. Also note that both arteries produce a kink before entering the skull. Vertebral basilar artery, or the vertebral artery, this is the third part of the vertebral artery, makes a kink below the skull before entering the through foramen magnum, and the internal carotid artery makes a kink in the carotid canal before emerging from the foramen lacerum to enter the skull. This kink is very important because it protects the cerebral blood flow from minor changes occurring in the blood pressure below the head at the level of the heart, for example. So ensures a steady blood supply to inside the skull. The internal carotid system gives off the anterior cerebral artery. This is the anterior cerebral artery. Curves around the corpus callosum, giving off orbital branches. Orbital means to the orbital surface of the brain. Callosal branches, callosomarginal branches. It supplies the paracentral lobule as well, reaches as back to the parieto-occipital sulcus, supplying the medial surface of the brain, and the arterial supply extends for a centimeter or so on the lateral surface of the brain. So it's responsible for the supply of the lower half of the body. This is the anterior cerebral artery. Don't forget that the internal carotid artery gives off the ophthalmic artery before giving off the anterior cerebral artery, which is important for the eye. Here we can see the vertebral artery uniting to form the basilar artery, ending as a posterior cerebral artery that ends by supplying the posterior part of the brain and the cerebellum. The middle cerebral artery, on the other hand, this is the middle cerebral artery, supplies the lateral surface of the brain, runs in the lateral sulcus, and it forms, it's a part of the circle of Willis at the base of the brain, important for supplying the deeper structures in the brain. It's the largest of the terminal branches of the internal carotid artery. So here the anterior cerebral artery, here the middle cerebral artery, and this is the end of the internal carotid artery. Here you can see the basilar artery, the posterior cerebral artery, and the superior cerebellar branches. Pontine branches, one of them will become the labyrinthine artery supplying the inner ear, and the vertebral artery giving off the posterior inferior cerebellar artery and the anterior inferior cerebellar artery, or the pica and ica, supplying the lower surface of the cerebellum as shown here. Now, to talk about the vertebral basilar system, as mentioned before, it unites at the lower border of the pons. The two vertebral arteries give off the anterior spinal arteries that unite to form the anterior spinal artery, posterior spinal arteries that remain as two separate arteries supplying the spinal cord, gives off also the posterior inferior cerebellar, anterior inferior cerebellar, before uniting at the base of the pons or the lower border of the pons to form the basilar artery, which runs on a groove on the basis pontis, giving lateral branches to supply the base of the pons and the internal ear, and gives off the posterior cerebellar artery and the superior cerebellar artery and the posterior cerebral artery. You can see these two arteries here. The posterior cerebral artery is connected by the posterior communicating to the internal carotid artery to complete the circle of Willis, which is completed anteriorly by a branch called the anterior communicating between the two anterior cerebral arteries. This is the circle of Willis. The basilar artery, formed at the lower border of the pons by the union of the two vertebral arteries, and runs on a groove on the pons and ends by giving off the posterior cerebral arteries. Again, don't forget that it gives off the labyrinthine artery that supplies the internal ear. Posterior cerebral artery, it's the terminal branch of the basilar artery or the vertebral basilar system. It supplies the posterior surface of the brain, including the cuneus, of course, and gives off branches to the cuneus, and that covers also part of the lateral surface of the brain, but posteriorly, not in the middle, because in the middle it's taken off by the middle cerebral artery on the lateral surface of the brain. So the posterior cerebral artery is important for vision because it supplies primarily the visual cortex, and for memory also because it supplies the inferior temporal area. The circulus arteriosus of Willis, achieved by anterior communicating artery that connects both two anterior cerebral arteries, the middle cerebral, the internal carotid artery, the posterior communicating artery to the posterior cerebral arteries, and it's middle cerebral artery considered not a part of this circle. It's a common site for aneurysms strokes are common, especially at the sites of bifurcation of the arteries given off the branches. See these thin branches called the striate arteries that perforate the brain substance, forming the perforated substance of the brain. There is anterior perforated substance here and posterior perforated substance here. These arteries goes deeper in the brain and supply the deep structures of the brain, like the thalamus and the basal nuclei and the internal capsule, with a common branch called the artery of Hübner that gets affected in situations like stresses, for example, resulting in paralysis of the opposite side of the body. These are the branches of the circulus arteriosus of Willis, showing in details the striate arteries. You have the anteromedial arteries, the medial striate arteries, the posteromedial central arteries, the lateral striate arteries, posterolateral striate arteries. It's all tiny branches, minute branches that perforate the brain to supply the deeper structures. This is an X-ray angiography showing the circulus arteriosus of Willis. This is the basilar, the posterior cerebral artery posterior communicating and the internal carotid, anterior cerebral artery and the anterior communicating. It's showing evidently here, and these are the branches of the middle cerebral artery. These are the areas supplied by the various blood vessels supplying the brain. This belongs to the anterior cerebral artery. See, it encroaches on the lateral surface of the brain for about an inch or so. Most of the middle portion of the lateral surface of the brain is supplied by the middle cerebral artery, so it supplies the areas responsible for the upper part of the body, including the head, the face, speech areas, the hearing areas. And the blue area is the area for the posterior cerebral arteries, a little bit on the lateral surface of the brain as well. The whole occipital area is supplied by the posterior cerebral artery, and this is how it shows from the medial surface of the brain, with all the rest supplied by the anterior cerebral artery. Now, venous drainage, it's through two systems, either the dural venous sinuses or the veins, the cerebral veins. The dural venous sinuses, they are spaces between the dura and the bone. They are lined by epithelium or endothelium, so they don't have muscle wall. That's why injury to the dural venous sinuses results in uncontrollable hemorrhage, because there is no muscle wall to spasm and control the sinuses or the bleeding. They include the superior sagittal sinus, the inferior sagittal sinus, transverse, sigmoid, occipital, confluence of sinuses, cavernous, sphenoparietal, superior petrosal, inferior petrosal, and basilar sinuses. Well, all these will end up eventually emptying into the internal jugular vein by means of the sigmoid sinus. Sigmoid sinus and inferior petrosal sinus, to be precise, that form the internal jugular vein at the margins of the jugular foramen. This is to show you the superior sagittal sinus between the dura and the skull. Inferior sagittal sinus runs in the free border of the falx cerebri, unites with the great cerebral vein of Galen to form the straight sinus. This is the great cerebral vein of Galen. To form the straight sinus at the roof of the tentorium cerebelli that merges to the confluence of sinuses, where in most cases the straight sinus forms the left transverse sinus, and the superior sagittal sinus forms the right transverse sinus. That's why the right transverse has more blood than the left transverse, so grooves the bone more. Then the sigmoid sinus that forms the internal jugular vein at the jugular foramen. This is the cavernous sinus receiving these sphenoparietal sinuses. They are connected to each other and drains by means of the superior petrosal sinus and the inferior petrosal sinus. The inferior petrosal sinus opens into the sigmoid, as you can see here. This is angiography to differentiate between arterial angiography and dural venous sinuses angiography. Well, from your knowledge, there is no artery that superficial near the bone, so this must be a venography. This is a venography showing the dural venous sinuses. This is the superior sagittal sinus. This is the transverse and sigmoid. The straight sinus here, and this is the great cerebral vein of Galen, as shown here, with the internal cerebral vein forming it. So this is a venography, or the magnetic resonance venography, to show the dural venous sinuses of the brain. Now the other system is the cerebral veins. These are proper veins which has muscular wall, not spaces between the dura and the skull. They comprise certain groups, external cerebral veins and internal cerebral veins. The external cerebral veins are superior group, middle group, and inferior group. You can see here the superior group draining into the superior sagittal sinus after passing in the subdural space. So they are liable to get torn in cases of head injury and with delayed symptoms of hemorrhage, because the hemorrhage spreads all over the subdural space, takes about a week or two before compressing the underlying brain. So it's important to obtain history of head trauma from people suffering from intracranial hemorrhage, if you are suspecting a hemorrhage from the superolateral cerebral veins, the ones you see here. Microcirculation, well, it was shown that the amount of capillaries in gray matter is 4 times that of the white matter. So the gray matter has more blood supply than the white matter, and the capillaries are tight, forming the blood-brain barrier together with the podocytes of the astrocytes, and we studied this before. The podocytes rest on the walls of the capillaries, making the blood-brain barrier together with the basement membrane and the endothelium lining of the capillaries. They prevent overstretching with increase in blood pressure. When the pressure increases, it leads to leak from capillaries and edema develops. Also in cases of strokes, strokes either occlusive, means occlusion of the affected artery by atherosclerosis, or in the elderly, for example, and hemorrhagic means they rupture as a result of aneurysm, for example. Now, cerebral edema develops, fluids accumulates in, it accumulates in the extracellular in the gray matter and interstitial spaces in the white matter, and intracellular also. This is called the cytotoxic type. Due to increase in capillary pressure or damage to capillaries, results in cerebral edema, and the most common cause is concussion. Once edema begins, reflects decrease in the cerebral blood flow. This will lead to 2 vicious circles, resulting in more cerebral edema and more worsening of the case. First of all, edema compresses the blood vessels, leading to decreased cerebral blood flow. This leads to ischemia, and as a result, there is a reflex vasodilation, which increases capillary pressure and more edema. Second, ischemia increases capillary permeability, results in more filtration from the capillaries, or more leak from the capillaries. This leads to further increase of the edema. So it's a vicious circle. To treat this case is by solution of high osmotic concentration substance like mannitol. I hope you got the maximum benefit from this lecture, and thank you very much for watching.